Hi everyone, Dr. Timothy Gallagher.
Dr. Michael Marciello.
And we're from Maragal Medical. Well, happy St. Patrick's Day. I know the video will run a week later. And when we get to St. Patrick's Day, we're always thinking about spring. Hard to believe spring is coming next week with all the snow on the ground. But when we're talking about spring, we're also talking about spring sports. So if you have a young athlete and they get injured, you're definitely going to want to stay tuned because we've got some exciting treatment options here at Maragal Medical if your high school or junior high school athlete gets injured. Stay tuned, everyone. Okay, Dr. Mike, it's almost springtime. There's still snow on the ground. You and I are both past spring athletes with baseball and with tennis. It's always the toughest time of year, particularly the beginning of the season with the weather here in New England. But, you know, we got a lot of children out there, high school, middle school, and even some college athletes getting ready for their spring sports schedule. And there are a lot of advantages coming to Maragal Medical if you do get injured and how we can treat you conservatively, right?
Absolutely. The concept is, again, a lot of athletes may not be preparing well enough to jump into that spring cold weather here, or they were playing their winter sports and then they didn't have a chance to get ready for their spring sport and their tryouts because you want to impress the coaches, of course. And so what happens is a lot of overuse strains, is using those arm muscles for throwing sports that haven't done that, the overhead aspects of the tennis play, and just putting on your new pair of cleats because we're supposed to get out into the ground, but it's frozen, it's got snow on it, and so really people don't break in their shoes very well. So there's a lot of things that can come on repetitively, and again, because of the just environmental issues that we deal with here in New England.
Right. So, if your son or daughter gets injured, okay, oftentimes it's not a severe injury where surgery is needed. In some cases it is, and you go to see the orthopedist. But if you just end up with a routine, sprain, strain, or some pain in the upper or lower extremity, really the first contact could be here at Maragal Medical. At our clinic, we have an advantage where we combine medical care, physical therapy, and chiropractic treatment under one roof. And we have the advantage, number one, to make sure that your athlete is getting an accurate diagnosis. And that's where you come into play, and with your nurse practitioner, Molly.
Yeah, we want to look at the acute injury, acute strain. Most things, as you mentioned, are really not that harmful, or again, they just start feeling like they're sore. So we can get you in early, identify if it's more just an overuse strain, or could there have been enough of an injury to get some diagnostic studies? Do we need to get the x-ray? Do we need to get even an MRI just to make sure? Because you don't want that athlete to be extending through the entire season, just nursing this injured area over and over and over again and making it worse. So acute early onset of reassessment is always important. And then we're looking at, again, the right diagnosis, as you said. So we're looking at the tendons, the muscles, the asymmetry. Is there an imbalance in their spine? Again, we're talking high school where a lot of people are still growing. They may have had a mild scoliosis that's gotten a little bit worse. They may have some asymmetry in their aspects of their workouts. So looking at those things that we can kind of put into place with our chiropractic service and our PT, and just making sure that the person is overall ready to take on that sport.
Right, and you and I, both former college athletes too, we have that expertise in figuring out when it's going to be appropriate to get your young athlete back into play. And then all of the conservative options, as a parent, you're going to want to make sure that your young athlete has the options to go through some conservative treatment where maybe it's not a prescription medication right away. Maybe it's some of the modalities that we use in our office that help to decrease pain, inflammation, and accelerate healing, like class 4 laser. As Dr. Mike said, obviously the chiropractor's role in the practice is to get those joints moving, and then when you combine that with physical therapy to work on improving flexibility and strengthening, then that's a winning combination. Now, if your athlete has a little bit more of a severe injury, maybe it's a partial tendon or ligament tear, That's not necessarily a rush off to the orthopedic surgeon either, correct?
No, we may just do a very short course of ibuprofen for 3, 4, 5 days. Again, getting that laser in there to get the inflammation down and making sure the muscles are moving through it. So that's where, again, we just need to say, well, there's no broken bone here. You're not going to be looking at, again, the orthopedic aspect different from our practice and the musculoskeletal component because there's no surgical needs.
Right.
So the aspect is getting into the office, making that assessment, and getting the therapeutic interventions in place. Get the inflammation down, whether we use some ice, combination of ice, laser, and again, a little ibuprofen or anti-inflammatory medicines. That's the way to start quickly, but then we want to continue with the care thereafter.
Yeah, and if you do have a partial ligament or tendon tear, we've got some really cutting-edge treatment options for your son and daughter. A PRP or platelet-rich plasma injection will really accelerate healing, right?
Yeah, so the PRP is using that person's own products and their blood component of breaking it down to the plasma. We spin it down and re-inject it. My gosh, it enhances healing, and when you're a young person, those healing properties are so remarkable that they allow healing to take place much more quickly. So something to that aspects of, again, an injection, much better than a cortisone injection at a young age. So we could do those procedures in order to get a person back when we know that this injury is just not just going to heal up a little bit on its own in a week or so. We may need to go to that next level, so we have that option here.
Yeah, and our son Ainsley is a great example of that. You know, 2 years ago he had a stress fracture in his foot after 8 weeks in a boot, wouldn't heal. We did a PRP injection, and in 4 weeks that fracture completely closed. If you'd like more information about our practice, please visit our website at maragalmedical.com. There's a wealth of information on our YouTube page. Consider subscribing to that page. Folks, the best thing yet is we take most insurances. Well, that's it for today. I hope you all learned something. Have a great day, everyone.
Bye now.